We are back with our next speaker, and I'm so proud to present one of our Apex social team members, Amanda Narra, who is a licensed behavior analyst. She is also a certified elementary education and special education teacher and earned her second master's degree in public administrations, grounded in leadership, ethics, and cultural awareness. It's amazing. Combined, she has over 20 years of experiences, and I couldn't be happier to have her on stage today. Amanda, the stage is yours.
Thank you so much, Nicole. I appreciate that warm welcome. So, thank you. All right. Thank you, everyone, for being here. I really appreciate it. Today, we are going to talk about debunking the myths of applied behavior analysis. All right, so this is what we're going to go over today. We're going to do a brief review about what ABA is. We're going to talk a little bit about the history, how it came to be. We'll review the pros and cons, and we're going to review some facts and myths about ABA. Then we'll go over some best practices and how ethics plays a role in ABA therapy. So ABA means a lot of different things to different people, and I'm going to do my best today to introduce it to you in a way that's easy to understand and makes sense. Applied behavioral analysis is the application of methods that we use to increase or decrease behaviors. So these are things that we want to see happen and the things that we don't want to see happen. It focuses on meaningful change to the individual. The behaviors are skills that are important to the person and their family. It considers their culture and their community as well. ABA also addresses behaviors that we can see and describe. It uses evidence-based methods grounded in research to help behavior, meaning that the strategies used are often proven to be effective. Lastly, ABA monitors data to be able to make decisions that ensure meaningful change takes place. It's actually a misconception that ABA is just a treatment for autism. It can actually be used with anyone for any reason. We will take a look at this later on, but at first, we're going to take a quick look at how ABA came to be. So there's no clear date of when behavior analysis started because it's a field that evolved over time due to research and practice. While it goes back decades, the application of ABA is relatively new compared to other fields. I personally like to say that it's been on the path of fine-tuning all these years. So starting in the 20s to the 40s, behaviorism, or the study of behavior, was developed, as well as the study of involuntary and voluntary behavior. And this is when the term behavior modification was commonly used. Then in the 50s and 60s, ABA was invented. What this means is when the applied research started. And then through the 70s and 90s, ABA research and practice continued. So many of the effective techniques that were used during that time was also still used today. However, there are some techniques from that time period that were inappropriate and are no longer being used. In the 2000s is when ABA started to be more recognized as a treatment method for autism and related diagnoses. This had a lot to do with the support from the U.S. Surgeon General, as well as states adopting autism insurance laws. During this time, ABA became more regulated, including the development of best practices and ethical standards by overseeing organizations, which brings us to our next slide. Here is the statement from the U.S. Surgeon General and the many organizations that endorse ABA, such as the Academy of Pediatrics, the American Psychology Association, and the Autism Society of America. So now let's talk further about how ABA helps so many individuals and their families. As we just reviewed, ABA is backed by science and is highly endorsed. It's a field that's progressing over time and increasing positive experiences. ABA is holistic. It's a natural science, just like chemistry is. ABA is highly individualized. The individual's progress is only compared to their own. It is highly regulated. So over the years, the professional field of ABA has made efforts to increase oversight and accountability through their documentation, guidelines, and ethical codes. The field is becoming increasingly compassionate. There's a growing emphasis on this key component to therapy. ABA involves families. Family members are involved from the onset of services. Their input is added from the time of their initial assessment, and it lasts through the lifetime of their services. ABA encompasses flexible teaching. So it can be utilized in a variety of settings and situations. While there are many positives about ABA therapy, we do recognize there are some limitations. So let's address some challenges of ABA. Well, it can be time-consuming and tiresome for families and individuals, especially after going to school or work all day. It does leave little time for other activities and obligations. However, one way that you can combat this is by having sessions in your home versus in a center or clinic. Another way is to include ABA in your everyday routine. For example, let's say your child has a doctor's appointment. You could always have the therapist attend with you. And so this way the goals can be worked on in the community and within the natural setting. So results are not immediate. Most of the time we're working on skills and using strategies that affect future behavior. This means that you'll not always see the results right away. There is no magic wand and the progress happens over time. It's actually a very gentle and systematic approach. ABA can be expensive. So this is true if you have high co-payments or you have to pay out of pocket, but most insurance plans do cover ABA. Another challenge is that ABA's provider skills and experience vary greatly. So there can be a large gap in skills and work experience. However, this is being addressed by the field, and providers are now being encouraged to have multiple experiences and clinical supervisors, which helps. There is a high turnover rate in providers, especially for the direct one-to-one therapist, and this is happening industry-wide. One of the reasons is because the position is entry level, meaning that the criteria is high school diploma and above. Given this, the starting pay rate is usually above minimum wage, but still on the lower side. Another reason is that therapists use this position as a stepping stone in their career. They'll often further their studies, and then they'll become behavior analysts themselves, or they'll move to a related field. So next we'll talk about how we make decisions and form our beliefs about ABA. So we will typically do this by analyzing what are our past experiences. What are you reading or watching that gives you that impression? What were you told about? Maybe a friend or a relative told you a story. So I suggest that people proceed with caution. And I say this because many people out there are creating methods or treatments that are not well researched or evidence-based. They'll use tactics that play on people's emotions to sell their product. So you want to be a smart shopper or consumer. You want to be skeptical. If it sounds too good to be true, it probably is. I put together some resources to help you make informed decisions. But first, let's go over common facts and myths. So this part is fun. All right. So if you can and you want to, you can, write in the chat, and we're going to go over each one of these. So ABA is a cure. So what do we think? Fact, myth? Think. Many of us kind of know that there is no cure, treatment here, but ABA does address the symptoms that your loved one may be having. Okay, ABA only treats autism. So is this a fact or a myth? I actually did just review that in the beginning where I said ABA can be for anybody, so that's definitely a myth. ABA is child-led. So if you're observing an ABA session, you will see that a lot of times the therapist is maybe kind of directing things, and that's supposed to be happening. However, this is a fact that the child does lead the sessions. We take our cues from them. If they can't tell us what they want, we're observing them and we're reacting to it. And we just want to, make those sessions totally fun, and we let them lead them. Okay, for our next one, ABA creates robots. So this one is definitely a myth. It is not something that we are ever trying to do. Sometimes the people that are being treated with ABA can have the same type of responding, which maybe would sound or look like robotic. But if ABA is implemented correctly, it is being done in a way where we are asking things in a different way, different settings, different people, and we really are working very hard to get naturalistic responses. So no, in no way is ABA creating robots. So the next one, ABA is forceful. This is something we've heard. However, of course, that is a myth. It's definitely not forceful. Like I said, it's more gentle. If anything, we take just very specific approaches and build in a lot of fun and go about this in a fun way. So it's not a bad experience at all. All right, so that brings us to our next one, which is ABA is fun and includes floor play. And that is definitely a fact. So we love to go from playing maybe a game at the table to making a puzzle on the floor. We love to go outside and go on the swing set. We'll go into the community if we're working on maybe on shopping skills with an older child. We definitely want to make everything fun and include floor play as well. All right, so here is some more. All right, ABA does not acknowledge unique differences. So that one is definitely a myth. We actually love to bring out what is special about your loved one or maybe you. We like to bring those preferences. So one of the things that we always do is we say, what do you like? What do you enjoy? And we bring that into our sessions. The next one, ABA tries to make a person normal. Well, we can see why somebody might say that. However, it is a myth. We are just trying to work on goals, progress the skills that somebody has, or even maintain those skills. So in no way are we trying to change them or make them normal. We actually do the next thing. ABA gives choices and teaches skills. And that is definitely a fact. So we give lots of choices. We teach choosing alternatives. And this is where replacement skills come in. So we're always teaching what to do or what to do instead of a behavior we don't want to see. We're teaching the ones we do want to see. Anyone can provide ABA therapy. So do we think that is a fact or a myth? This can be a little tricky. I would like to start with saying, no, of course, not everybody could. However, if you are interested in learning, everyone has the chance to go ahead and learn. So there are so many great programs out there and courses you can take if you're interested in doing that. And if you are a parent and want to learn how to become a provider, I have a resource for that later. ABA uses bribes, or they bribe children. That is a myth. That is false. Sometimes it can look that way, but we actually use reinforcers and preferences in a very specific and systematic way so that we are increasing behavior. It is not a bribe. The next one, ABA has changed for the better over time. So we kind of went through that in our history, right? That is a fact. Absolutely, the field has been progressing, changing, adapting. For a relatively new field, we've come a real long way. All right, we have a few more here. All programs are the same. So let's see, that is a myth. It's high, like we did say this, it is individualized. And that is such an important part. I could see where somebody might say they look similar, and that can be true because the symptoms are similar. And we're working on some of the core domains like communication, for example, or daily living skills. So there are times where they may look similar, but everything is always individualized to that person. And we meet them where they're at and then bring them to where they need to be. And that's something I love about ABA. ABA does not consider emotions or feelings. That is definitely a myth. One of the skills that we teach is how to have people communicate their emotions or feelings. So that's something that, we also take it into account how the families feel. We're always asking for their input and how they feel about things. And so if anything, I would say that ABA considers them to be a great aspect of our therapy. ABA is too time consuming. Okay, well, I agree. It is time consuming, but I also say that it's a myth because there are ways we spoke about before how you can integrate your ABA therapy into your everyday life. So it is possible that it doesn't have to be time consuming if we build it in the correct way. Therapists are working outside of their practice areas. So this means that some people feel, well, ABA therapist shouldn't be maybe doing what speech is doing or what my occupational therapist is doing. But it is definitely a myth because what happens is that ABA actually crosses over other professional therapies. So, we are also working on language development and maybe fine motor skills. And so maybe gross motor skills. So then you're like, wait, that's physical therapy. But really, we are always collaborating with the other related service providers. And that's something that's really special about ABA that we do. We're always collaborating so that we don't work on the same goals, or if we're working on similar goals, we're working on them in the same way. And there's a care team approach. So lastly, ABA focuses on reinforcement and promote natural responses. And that is a fact. We are always looking to make everything as natural as possible. We teach in natural environments and it's just a really wonderful thing that we are always saying, reinforcement first. And that is such a tenet of ABA. So now we're going to talk about best practices in ABA. All right. So the 3 key points to think about when you're making a decision on ABA treatment is you want to consult with medical providers. So you want to talk to your loved one's doctors about treatments options or your own doctors. You want to ask for referrals. So when you're choosing an agency or a provider, it can be really daunting. And having the contacts of trusted agencies can be really comforting when you go ahead and decide this is something you want to do. You also want to remain skeptical and you want to be able to weigh your treatment options. So before services, you want to make sure that the ABA providers are certified, licensed, experienced. You want to set realistic expectations and you want to be familiar with ethical practice. And this is something we'll review in just a minute. So during your services, it's really helpful for you to be involved and upfront with your providers. Do your best to participate in the parent and family trainings that are offered to you, or if they're not, you can always ask for them. If there's any changes, you want to inform your team. Being thankful to your providers and making them feel appreciated is really important. When you're acknowledging their hard work, they'll want to keep coming back and even work harder. you're going to want to watch for red flags. If something doesn't feel right or look right, you're going to follow your gut. And then if that's happening, the next thing you can do is talk to your ABA providers. By sharing your thoughts and your feelings with them, they can address your issues quickly and help resolve them. Sometimes there's just a miscommunication or information that needs to be shared. So lastly, you want to continue to have a strong relationship with your providers, open communication, and this will really help with the success of the therapy. So as we talked about earlier, ethics plays a large role in providing high quality ABA services. So let's take a closer look to what type of guidelines providers follow. Here are samples of the actual code of ethics that an RBT and a BCBA follow. They're developed by the certifying board, and more information can be found on their website. In my role at Apex Social, I have had the pleasure of watching this professional childcare company raise the bar in providing high quality services and embracing the special needs community. About 2 years ago, Apex Social developed the Educational and Therapeutic Resources Team, or the ETR team. And as their director, I took the lead in integrating the best practices from the education and behavior professions to support host families and care professionals. So our ETR team provides family consultations, coaching and mentoring to care professionals, courses and workshops as well. And those courses could either stand on their own or they complement our Apex Individualized Care Plan, or AICP. The AICP is our team's signature work. It's a care plan written by our team with the help of families and individuals, which guides care professionals in providing everyday care for children to reach their milestones or their goals. It uses widely acceptable parenting techniques as well as fresh ideas presented by our ETR coaches. Not all of them have to be grounded in ABA. We are happy to work with whatever your suggestions are, and we just want to bring our expertise to the table. So to top it off, the care professionals take data and it's monitored by our team and shared with families. So we'll take a quick look at the resources that we have for you. The first is, if you go on the website for the Association for Science and Autism Treatment, they have summaries with a balanced view, along with a parent packet and resources that help you figure out the difference between false or inaccurate information and what's true and evidence-based. So they will help you, put out the options for you and weigh them in a really fair and balanced way. The Council for Autism Service Providers has a fact sheet that you can download that's especially made for families. And if you're a parent looking to take a course to be an ABA provider for your own child, Florida Health can help you do that on their website. You can go for more information. So here is my email, and you are welcome to contact me at any time. And I just wanted to thank you all so much for being with me today. I truly enjoyed talking about a topic that I'm passionate about.
That was amazing. Thank you, Amanda, so much for this presentation. We both know it is a controversial topic and there's a lot to discuss. So I do understand some of those questions that appear. We will take a look at some of those questions. Angela Hüttemann asks, what are challenges for ABA in our current environment?
Yeah, I would say one of the biggest challenges is getting health insurance funders to cover ABA therapy for any diagnoses that are not autism, because it's that's where it started. And so we have the most research on that population. However, it is shown and has always been effective for any type of behavior treatment. We can say that even includes somebody that's looking to just work on their health. And that's so that I would say that's our biggest challenge.
Okay, perfect. Thank you so much. And maybe a last question from Kira Woolley. What role do parents or caregivers play in the ABA process, and how can they support their child's progress outside of a therapy session?
Oh, that's such an excellent question. I really appreciate you asking that. So I would honestly say that parents have the most important role. They can make all the difference. I would say if your child is receiving ABA treatment, that you are able to shadow that a little bit, peek in, be a part of it. Ask if you're not getting the family training sessions, ask for them. They are led typically by the behavior analyst. However, you can participate in your child's therapy as much or as you would like, and you could sit next to your therapist. You can ask to put a camera where they're working and maybe observe that way. So if you're afraid of interrupting the sessions, that's something that parents have came to me about. But we do have ways of being able to do that. But yes.
Perfect. Well, thank you so much, Amanda. That was very interesting. We got a lot of input and information. Thank you for being here with us today. For the rest of the audience, it is the last chance for you to connect with other parents, teachers, care professionals, go to the speed friending session, connect the last time, and then we will be here for our last speaker, Ferris. So just have fun, enjoy 20 minutes, and then we will be back here on the main stage with our final speaker.